Blood clot is the main cause of stroke and heart attack. Know the signs and symptoms, risk factors and prevention. What is a blood clot? Blood clot is a mass of blood formed to prevent bleeding when you are injured. When blood clots form inside an artery or vein, they could prevent the flow of blood to the lungs, heart and brain, which can lead to a stroke and heart attack. How do you know that you are having a blood clot? Symptoms of blood clots depend on their location in the body. In some cases, people don't feel or notice that they are having blood clots until the clots rupture or travel through the circulation. Here are the symptoms of blood clots in specific body locations. Legs, deep vein thrombosis or DVT. Pain, redness and swelling on the area of the leg. DVT can also occur with no symptoms. A clot on the leg can be very serious because it could travel through your bloodstream to the lungs, blocking the blood flow. This would result to pulmonary embolism. Arterial blood clot in the arms or legs. Pale color, numbness, loss of feeling, and coolness to the touch. Blood clots in the lungs. Chest pain, shortness of breath, fainting, rapid pulse and breathing. Blood clots in the arteries of the brain leading to a stroke. Loss of speech and vision, dizziness and weakness on one side of the body. Blood clot in coronary arteries leading to a heart attack. Chest pain, shortness of breath, nausea, indigestion, sweating. Blood clots in the arteries that supply blood to the intestine. Abdominal pain, bloating, nausea, blood in stool. The following are risk factors for developing blood clots. Prolonged bed rest after a surgery or paralysis. When your legs remain still for a period of time, blood don't circulate properly, which can increase the risk of blood clots. Injury or surgery to your vein increases the risk of blood clots. Pregnancy. Blood clots can develop due to an increased pressure of the veins in your legs and pelvis. Birth control pills, oral contraceptives, and hormone replacement therapy increase the ability to develop blood clots. Obesity and being overweight increase the pressure of the veins in your legs and pelvis, which can cause blood clot. Sitting for a long period of time, such sitting on cars, bus or airplanes. Blood clots can form in the calves of your legs if muscles don't move for hours. Smoking affects blood circulation that can cause DVT. Cancer. Some substances in the blood of people with some forms of cancer can cause the blood to clot. Heart failure can increase the risk of pulmonary embolism and DVT because of the limited function of the heart and lungs. Some inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, can increase the risk of blood clots. Family history of pulmonary embolism or DVT. Age. People over 60 years old have a greater risk of developing DVT, although it can occur at any age. Inherited blood clotting disorders. How to prevent blood clots. Know your risk for blood clots and recognize its signs and symptoms. Tell your doctor if you have a family history of blood clots. Before surgery, ask the advice of your doctor if you need blood thinners or compression stockings. Ask your doctor for options to prevent blood clots if you are to be confined in a bed at home or in a hospital following a surgery or due to paralysis or illness. See your doctor immediately if you notice some signs and symptoms of blood clots. Blood clots can be safely treated. Avoid smoking or try to quit smoking. Move, exercise and stretch your legs every 2 to 3 hours. Seek a doctor's advice if you need to have blood thinners. Lose weight and stay active. Avoid long periods of staying still or sitting down. Drink a lot of water. Avoid tight-fitting clothes while traveling. Whenever you travel in a bus, train, car or plane for more than 4 hours, get up and move around at least every hour if possible. If you cannot move around while sitting down in offices, point and flex your toes and make circles with your feet to get more circulations on your legs. Raise your legs 6 inches above your heart from time to time. Try not to cross your legs. Keep your heart, diabetes and other health issues as stable as possible. Eat less salt and eat more fruits and vegetables. Remember, prevention is better than cure.